Did you know that 1/2 of all American adults have high blood pressure? 50% of us. And most people with high blood pressure still don't have their blood pressure under control, and it's wreaking havoc on their bodies. High blood pressure, or hypertension, damages blood vessels and vital organs over time, which then makes us prone to unfortunate things like heart attacks and strokes. Major contributors to high blood pressure are the unhealthy components of our diet, especially sodium intake. So in this video, we'll talk about a few specific dietary changes that people can implement to naturally lower blood pressure to lower the risk of the #1 killer in the world, cardiovascular disease. Hey, welcome back to the channel. I'm Zane, a primary care doctor, and here we discuss easy ways to live healthier. Regardless of whether someone has hypertension, normal blood pressure, or falls in that limbo area between the two known as elevated blood pressure, there are 3 specific dietary changes that may delay or reduce the need for medication. And for some people, eliminate the need for medication altogether. Not only that, they can also help you live longer. They are limiting sodium, limiting alcohol, and following the DASH diet. If you have a medical condition or you're taking medication, it's best to discuss any lifestyle or medication changes with your doctor to avoid any adverse effects. In general, gradual changes are easier to implement than drastic ones, so ease into these lifestyle changes and allow your body to adjust to them. Limiting excess sodium. Since the mid-1900s, we've known that too much salt in our diet can raise our blood pressure. The scientific name for what we know as table salt is sodium chloride, and it's the sodium that's the real culprit in hypertension. Under 2,300 milligrams or 2.3 grams of sodium per day is recommended for people 14 years and up. But some people may benefit from even less sodium intake depending on their condition. To put things in perspective, 2,300 milligrams of sodium is in 1 teaspoon of salt. In contrast, most Americans take in an average of about 3,400 milligrams of sodium per day, almost 50% more than the recommended daily intake, and it's unnecessarily increasing the rate of chronic medical problems. Most natural foods don't come with a lot of sodium, so most of the excess sodium that we consume is added by us or when food is processed or canned. Minimizing processed foods and choosing low salt options can make a big impact on our blood pressure and our overall health. Gradually reducing salt intake to the recommended level will be more palatable than doing it drastically. Making gradual changes also gives your body a chance to adjust in order to avoid any adverse effects. Adding herbs and spices to meals may reduce the amount of added salt needed to make food taste good. And as a bonus, these 5 spices have been shown to have natural blood pressure lowering effects on their own. Win-win. They are black pepper, cinnamon, paprika, garlic, and turmeric. Adding them along with certain other herbs and spices can have the triple effect of directly lowering your blood pressure, normalizing your sodium intake, and making your food taste better. Most people benefit from reducing sodium, but some people start to feel bad if their sodium goes too low. There are also some situations where you may not want to limit sodium, such as if your sodium is already too low, known as hyponatremia, or if you're acutely ill with something like a stomach bug. If this sounds like you, or you're on medication or have any chronic medical conditions, talk to your doctor before making dietary changes. In general, many diet-related issues can be avoided by having a consistent and well-rounded diet that contains a variety of healthy foods, like the Mediterranean or the DASH diet. Limiting alcohol. Any amount of alcohol can be bad for you, but having more than 2 drinks a day on average can definitely increase your risk of hypertension, and the risk increases as the number of drinks increases. So if you're having more than a couple of drinks a day, the more you cut back, the better your blood pressure can get. And as a bonus, it'll lower your risk of cancer and other diseases as well. Remember that 1 shot, 1 12-ounce beer, and 1 glass of wine are all considered to be 1 drink. The DASH diet. There's a specific diet called the DASH diet that's been shown to improve blood pressure and help people live longer. It incorporates a lot of healthy foods like vegetables and whole grains, and is considered to be one of the best diets for people with high blood pressure or for people at risk of developing it. It's even great for kids. Not only that, it can be modified for people with dietary restrictions or certain medical conditions or food allergies. The beauty of a healthy diet like the DASH diet is that not only are the foods like bell peppers, oranges, and pomegranates themselves helping to improve your blood pressure, like those spices I mentioned earlier, but they can also help you lose weight, which then further helps your blood pressure and improves your overall health and decreases your cancer risk. Here's a typical serving guide for someone on the DASH diet. 5 servings of vegetables a day and 5 servings of fruit a day. This equates to 1 to 2 servings of fruits and vegetables with every meal, and possibly more for snacks. 7 servings of heart-healthy carbohydrates per day, for example, beans or chickpeas, and one serving equates to about 15 grams of carbs. You can basically Google the grams of carbs in any food, but this boils down to about 100 grams of carbohydrates a day, and fruits, vegetables, and dairy don't count towards that total. 2 servings a day of low-fat dairy products like skim milk or Greek yogurt, no more than 2 servings of lean meat a day. 1 serving of meat is about 3 ounces or the size of a deck of cards. So to recap, 3 ways that you can improve your blood pressure now and going forward are limiting sodium to 2,300 milligrams per day and sometimes lower, sticking to under 100 grams of healthy carbohydrates and lots of servings of fruits and vegetables and less meat, and limiting alcohol to no more than 2 drinks per day. Well, friends, I hope this information was useful and can aid you on your journey to better health and a long and happy life. If you enjoyed this video, hit the like button and consider subscribing to this channel. Thanks for watching. Peace and stay healthy.